Deep breaths.
Dr. Sujay Iyer makes life and death decisions every day. His job is getting harder. As the population grows older and sicker, doctors are being asked to do more with less.
At the moment, the doctors and the nurses together are struggling to provide the kind of state-of-the-art care that we are used to providing. And it's kind of unfortunate that it's come to this.
Here at Wolverhampton's New Cross Hospital, they've introduced fellowship programmes to tackle the staffing crisis. Unless something is done, there could be 360,000 NHS vacancies by 2036.
Today, we're announcing the most ambitious transformation in the way that we staff the NHS in its history.
The 15-year government-backed plan aims to recruit and retain over 400,000 more NHS staff.
We hear time and time again from leaders in the healthcare sector and the public. We need more doctors and nurses to ease the pressures, and we need reform to free them up to do their jobs properly. And they're right.
Thank you very much.
It's hoped extra training places will reduce the reliance on overseas and agency staff.
We've relied on the skills and dedication of staff who came here from the four corners of the globe to care for patients, and there will always be a place for them in the NHS. But demand for healthcare workers is increasing, so doing nothing is not an option.
Thank you very much.
The plan has to deliver for patients and staff, but faces challenges. For the workforce plan to meet its targets, it requires greater productivity and efficiency. But that's a big ask of a workforce which is on its knees after coming through a pandemic and another NHS winter crisis. Even the report's authors say the productivity assumption is ambitious. Over 40,000 nurses have left the NHS since 2018, going abroad or quitting the profession. Caroline Johnson is one of them.
I was a nurse in the NHS for 17 years. I was burnt out. I had to leave. I'm never coming back to the UK again.
After working as an advanced nurse practitioner in London, she moved to Australia.
I get fatigued just thinking about the NHS because of how much we used to work, how hard we used to work, how hard I used to put so much energy into, and feeling like you still didn't achieve enough at the end of the day.
The plan is ambitious, but its targets must be met for the health of the NHS and its patients. Ashish Joshi, Sky News.